Okay, so how do we adjust parameters? This is an individualized adjustment. We need to know the machine well enough to know what adjustments we can make to make it work best for each individual patient. We obviously need to know the goals for each individual patient. We want to see how well they tolerate it, meaning how high a pressure can they take, how well do they do with the different flow settings, are they able to seal their mouth around the lip piece, the mouthpiece, or do we need to give a mask treatment? How much is the patient able to participate? And then when we look at volumes, we want to make sure we're delivering at least 10 to 15 mils per kilogram of ideal body weight in that volume that we're delivering. So we will need to know the patient's ideal body weight. So we give a duration of the treatment of around 15 to 20 minutes. Some institutions are going to use 10 minutes. We always want to measure the volume because the volume is what judges the effectiveness of the treatment or the therapy. The mission is measured in two ways, either with a right respirometer that's hooked up to the expiratory limb of the circuit and it measures that gas flow and gives a volume of exhalation, or we're going to use something called the venti-comp bag, which really is a big plastic bag that we hook again to the expiratory limb of the Ippb circuit that captures all the exhaled gas and gives us an estimated volume based on how many breaths it takes to fill the bag. What do we want to record or chart from these treatments? Well, we want to record the patient's response. I mentioned these things, but again, how well they're able to seal their lips around, how much they're able to participate. We want to let the next therapist know the machine settings. So what did we set for sensitivity? What was our flow setting and what was our pressure setting? And then we want to chart the volume achieved because we can track then if we were able to get the pressure setting up to 25 centimeters of water, and that achieved a volume of 1,200 milliliters, we would have a good baseline value. If we came back then 30 minutes later, or no, sorry, not 30 minutes, if we come back 4 hours later, and we were able to get up to 30 centimeters of water with the patient, and then we were able to get up to a volume of 1,500 milliliters, we would be able to have documented improvement in this therapy. But we only have those, we can only document improvement if we've monitored all the settings and recorded them, and then tested the volume that the patient was able to achieve. During the therapy, we're going to want to continually monitor the patient's response and look at machine performance. Machine performance adjustments can be the sensitivity setting. We want to look at the highest pressure that was able to be achieved, the flow settings that were used. We can look at the patient's response also via changes in breath sounds or changes in oxygenation, increased ability to clear secretions. Those are some of the measurements we're going to take. We'll also want to note the rate that was used and paying attention to the I to E ratio. So remember, Ippb is used when patients are unable to breathe deep enough spontaneously to effectively treat their atelectasis. Deep breathing is used for, again, inflating the collapsed alveoli, mobilizing secretion, and it's required for an effective cough. So Ippb can be used to help give the patient a big enough breath so they can have an effective cough. What treatment is normally used to treat or prevent postoperative atelectasis? If you're thinking of sensitive spirometry, you're correct. Under what conditions might we choose Ippb? If you're thinking those patients that we've tried with IS but they were unable to get 30% or more predicted volume, that would be a reason. We may also have a patient with a dysfunctional diaphragm that's not able to take a deep enough breath to clear their secretions. That might be another reason we would use Ippb. I mentioned that the Ippb circuit includes a nebulizer that is either going to be filled with normal saline or a bronchodilator. It's never left dry. So the machine that we'll be working with in lab and that's used in the Boise Valley is the Bird Mark 7 respirator, or the Bird Mark 7 Ippb machine. It has three primary controls that we adjust. The sensitivity, which is set on the one side. It has a pressure setting, which is on the other side, the two main knobs on the side, and then the center control is the flow control. This silver knob here, that's the air mix, and the lowest one is a backup rate if the machine was used as a ventilator. You'll see there's a pressure manometer on the front of these. The pressure manometer is more likely to be correct. Generally we'll use, if there's a pressure manometer there, if it's calibrated correctly, it's a really good indicator of what the actual pressures being reached are. So sometimes we'll set a pressure of 10, and if this machine has not been accurately calibrated, we could have a pressure setting at 10 over here, and if this goes up to 12 centimeters of water pressure, we're going to believe the manometer. The manometer on these machines is more accurate than what we set over with this control for pressure. When I talked about sensitivity, if this is the 0 mark on this manometer, this is going to be the negative side, and this is the positive side of this manometer. So when the patient first initiates a breath, we're going to see the manometer go a little tiny bit to the negative side. Once the breath is triggered, the arrow or the dial on the manometer should have a nice slow and steady rise up to the set pressure. When the pressure has been met, the breath will cycle to exhalation, or the machine will cycle to exhalation, and you'll see that manometer fall back to 0. Here in this picture you can see how the circuit is connected to the Ippb machine, the circuit, and there's a pressure line that's hooked right next to the large bore tubing. There are several other Ippb machines made by other manufacturers that are discussed briefly in Egan. This concludes our recordings on Ippb. Please check your book for further readings. If you have any questions, please let me know.